Hello friends, today we are going to talk about depression. What is depression? What are the criteria to diagnose depression? Depression is a condition or mental disorder which includes the following. Number 1, depression. Depressed mood. Mood is low to a degree that is definitely abnormal for the individual. It's present most of the day and almost every day, largely uninfluenced by circumstances and sustained for at least 2 weeks. So, low in mood, sustained for minimum 2 weeks. So that is the first symptom. In fact, out of the 3 symptoms, there should be minimum of 1 to be present for 2 weeks, along with other symptoms which we are going to talk about. Number 2, loss of interest. Or loss of pleasure in activities that were normally pleasurable to that particular individual. So if person used to like playing football and he's not playing anymore, he has lost interest and lost interest in a number of other things that they would do. So this is particularly for that individual. And again, it must be present significantly so that it's affecting their life. Number 3, energy levels. They are decreased to the extent the person gets fatigue very easily. Fatigue. So either they don't have any energy, so they're not able to get up and do things, or even if they do certain things, they get tired very quickly. They feel as if they have no energy. No energy. Out of these 3 symptoms, minimum of 2 must be present, or if 1 is present, it is severe. The other criteria for depression is, in addition to above, there should be what we call like psychological symptoms. Psychological symptoms. And they are, number 1, loss of confidence. Loss of confidence or loss of self-esteem. They are not confident anymore. Whatever they used to do perfectly or in a good way, now they don't feel that they are able to do those things. So they end up doing nothing, and they lack self-esteem. They feel that they are not able to do it. They won't be good at doing it. So there is lack of confidence, and there is loss of self-esteem. Number 2, unreasonable feelings of self-reproach. So they keep on criticizing, self-reproach. They criticize themselves. They feel that they are not good enough, they are failure, they are not able to do anything, and feel quite negative about self. Or they have guilt, and this guilt is inappropriate and excessive for things they might have done or said anything to somebody, and they may be very minor things, but they feel very guilty about those things, which normally they would have ignored. Number 3, recurrent thoughts of death or suicide, or any suicidal behavior. So they are thinking of taking overdose or harming themselves or ending their life, or they feel like that life is not worth living. So they keep on having these thoughts. So thoughts of suicide. They feel that they shouldn't be born, they shouldn't be here, they are worthless, they can't do anything, they are not good for anything. Therefore, and these symptoms are persistent day after day, and they can't get these thoughts out of their mind. They just feel that, look, they are very depressed, they are not good. Number 4, complaints or evidence of diminished ability to think or concentrate. So their attention and concentration is poor, or at least they think they cannot concentrate, they cannot pay attention. Let's say if they start reading a book, they can't concentrate, they don't take much information. They start watching television, they say, no, I get distracted very easily, I don't enjoy, I can't concentrate, I don't remember things, I can't carry on like this. So there is always these thoughts that they can't think or concentrate, and ultimately this leads to indecisiveness. They can't make decisions, or they believe they can't make good decisions, therefore they are not helping anyone or helping themselves, and just keep on harboring these thoughts. Number 5, changes in psychomotor activity, meaning they are not, so motor activity is very much decreased. They don't want to get up, wash themselves, dress themselves, go out. They mentally feel tired, mentally feel that they can't do anything. So they just sit down, and if somebody tries to push them, they become agitated, restless, because they know they can't do it. And this, they may not notice themselves, others might notice more than the person who suffers with depression. Number 6, sleep disturbance. And this could be of any type. It can be difficulty going to sleep, keep on waking up in the middle of the night, or wake early in the morning. And still when they get up, they feel tired, lethargic, lack of energy, as if they did not sleep very well. They don't have that feeling of freshness that they will get up and do things. Number 7, appetite. Normally in depression, the appetite is poor and they lose weight. In some depressions, they eat comfort eating and they put on weight. But generally, that is the case. They normally don't eat much, therefore they don't have enough energy, they don't have appetite, they don't feel like eating. Now, what happens is, if it is a mild depression, only one of these, or one or two of these are present if they both are mild, or minimum two must be present, and then they must have at least two more of these to form the mild depressive episode. Or if they have more of these ones, or three of these ones, then they will fulfill the criteria of moderate depressive episode, especially if they have in total 4. And if it is more than 4 or 5, and including that the suicide thoughts are more prominent, then they will classify for the major depressive episode. Now, what happens is, depression can be a single episode, or it can happen again and again after a couple of years, after 6 months, again and again. So that is called recurrent depressive disorder. Or it can be part of the bipolar illness. When we say bipolar, there are periods of mania, hypomania, and depression. Generally, mania or hypomania may be just one incident, but there are repeated episodes of depression. Or it can be part of other mental illnesses, like associated with delusions or hallucinations, or they may be part of schizophrenia. And in schizophrenia, if the mental illness there, they can still suffer an episode of depression. And there can be other types of depression mixed with anxiety. It's called mixed anxiety and depression. Anxiety and depression. So these are the symptoms of depression. This is a well-recognized mental disorder and can be helped and treated with number of medications. These things can happen because of number of reasons that can include biological, psychological, and social, which we will discuss in our next video. Thank you for watching. If you like this video, please click on the like button.